Hey everyone, welcome back to my channel. We all know that pain, it's something none of us can avoid. Whether it's a stubbed toe or something more serious, pain management is a critical aspect of healthcare. Pain affects millions worldwide, and finding relief is a top priority for patients and doctors alike. But here's the thing, there are a lot of misconceptions surrounding pain medications. These myths can prevent people from seeking the help they need or lead to medication misuse. So in this video, we're going to separate fact from fiction and give you the knowledge to make informed decisions about pain management. Let's get started. Myth number 1. The belief that all pain medication leads to addiction. And look, I get it. Addiction is a serious concern. But here's the truth. While some pain medications, particularly opioids, carry an addiction risk, it's not a guaranteed outcome for everyone. Addiction is a complex disease involving brain changes and behaviors. It's about craving the medication, taking more than prescribed, and continuing use despite negative consequences. The good news is healthcare providers are well aware of this risk. We carefully assess each patient's pain, medical history, and risk factors before prescribing anything. We start with the lowest effective dose for the shortest time necessary and closely monitor patients on these medications. By working together, we can significantly minimize the risk of addiction. Remember, open communication with your doctor is key if you have any concerns. Myth number 2 is one I hear a lot. If I can tough it out, I shouldn't take anything. Let me tell you, ignoring pain is like ignoring a flashing warning light on your car dashboard. Pain is your body's way of telling you something is wrong. Ignoring it can lead to bigger problems down the road. Chronic pain, decreased mobility, and even the development of pain syndromes are all possibilities. The goal of pain management isn't to mask the pain entirely. It's about addressing the underlying cause while improving your quality of life. If you're in pain, don't suffer in silence. Talk to your doctor. We can figure out what's going on and find the best way to manage your pain, whether it's medication, physical therapy, or a combination of approaches. Myth number 3. Over-the-counter, OTC. Pain relievers are completely safe. We often think, hey, they're available without a prescription. They must be completely safe, right? Well, not so fast. While OTC pain relievers like ibuprofen or acetaminophen can be effective for mild to moderate pain, they aren't without risks, especially when overused. NSAIDs, for example, can increase the risk of stomach ulcers, kidney problems, and even heart problems in some people, especially when taken in high doses or for prolonged periods. Acetaminophen, while generally safe at recommended doses, can cause serious liver damage if you take too much. Always follow the directions on the label, and if you have any pre-existing conditions or are on other medications, talk to your doctor or pharmacist first. They can help you choose the safest option and dosage for your needs. Myth number 4. More medication, more relief? Not always. Here's another myth we need to debunk. More pain medication equals more pain relief. It's easy to fall into the trap of thinking, if one pill helps, 2 must be better, but that's not how it works. Pain management is not a one-size-fits-all approach. It needs to be tailored to each individual. Taking higher doses of pain medication than prescribed can increase the risk of side effects and complications without necessarily providing additional pain relief. In fact, it might even make things worse. Your doctor will work with you to find the minimum effective dose, the lowest dose that effectively controls your pain while minimizing side effects. We're aiming for that sweet spot between pain relief and safety. Myth number 5. Pain medications are the only solution for pain management. Now, while medications are an important tool in our arsenal, they're not the only weapon we have. Think of it like this. If you have a flat tire, you wouldn't just keep filling it with air and hope for the best, right? You'd want to find the source of the leak and fix it. Pain management is similar. We want to address the root cause of your pain, not just mask the symptoms. That's where other therapies come in, such as physical therapy, acupuncture, massage, biofeedback, and even cognitive behavioral therapy. These therapies can help address the underlying causes of pain, improve function, and enhance your overall well-being. Myth number 6. All pain medications have the same effect on everyone. Now, this myth is something I see a lot in my practice. The idea that all pain medications affect everyone the same way. We are not all walking, talking cookie cutters. We're unique individuals, and how our bodies respond to medication can vary widely. Factors like genetics, metabolism, the type of pain you're experiencing, other medications you're taking, and even your medical history can all influence how your body processes pain medication. What works wonders for one person might do nothing for another, or even cause unwanted side effects. That's why finding the right pain management plan is often a process of trial and error. Your doctor will work with you, adjusting medications and dosages as needed to find what works best for you. Communication is key here. Myth number 7. Using pain medication means giving up on finding the underlying cause of the pain. That is a common misconception. Let me be clear, taking pain medication doesn't mean you're throwing in the towel. It simply means you're managing your symptoms while we work together to identify and address the root cause of your pain. Think of it this way. If you break your leg, you'll likely get pain medication to manage the discomfort while the bone heals. That doesn't mean you're ignoring the broken leg. It means you're making the healing process more bearable. Pain medication can actually help in diagnosing and treating the cause of your pain. By reducing your pain levels, we can perform a more thorough examination, order necessary tests, and even begin therapies that might have been too painful before. Myth number 8. Pain medication should completely eliminate pain. Now, while we all want to live pain-free, the reality is that complete pain elimination isn't always achievable or even desirable. The goal of pain management is to reduce your pain to a manageable level, allowing you to engage in daily activities, improve your quality of life, and participate in your own recovery. Striving for zero pain can sometimes lead to unrealistic expectations and potentially over-medication. Remember, pain is a signal, and while we want to manage it effectively, we also don't want to completely silence your body's way of communicating with you. Myth number 9. It's better to wait until pain is severe before taking medication. Here's the thing. Pain is much easier to control when it's caught early on. Think of it like putting out a small fire versus battling a raging inferno. Waiting until the pain is excruciating can make it much harder to get under control, often requiring higher doses of medication and potentially leading to more side effects. Don't suffer needlessly. If you're experiencing pain that's interfering with your daily life, talk to your doctor. We can discuss your options and come up with a plan to manage your pain proactively. Myth number 10. Everyone experiences pain in the same way. This couldn't be further from the truth. Pain is incredibly subjective. It's influenced by a complex interplay of physical, emotional, and psychological factors. Two people with the same injury or condition can experience pain very differently. Factors like your past experiences with pain, your emotional state, your cultural background, and even your beliefs about pain can all shape how you perceive and cope with it. That's why it's crucial to have open and honest conversations with your healthcare providers about your pain. Don't be afraid to describe your pain in detail, what it feels like, where it's located, how it's impacting your life. The more information you provide, the better equipped your doctor will be to tailor a pain management plan specifically for you. So as you can see, there are a lot of myths surrounding pain medications. It's important to remember that pain management is a partnership between you and your healthcare provider. We're in this together. Don't be afraid to ask questions, advocate for yourself, and be open and honest about your pain. Remember, you deserve to live a life as free from pain as possible. By staying informed, communicating openly with your healthcare team, and exploring all available options, you can take control of your pain and live your life to the fullest. Stay healthy, stay informed, like and subscribe for more.